Hi everyone, good afternoon. A very warm welcome to you. As we celebrate Women's Day this month, this session becomes even more meaningful, highlighting the importance of prioritizing women's health, awareness, and well being across every stage of life. It's my pleasure to introduce our expert speaker, Dr. Archana Singh, a highly experienced obstetrician and a gynecologist, known for her expertise in managing high risk pregnancies and addressing women's health concerns across all the age groups, who will be guiding us today through today's session. If you have any questions, please hold on to them. You can put your questions in the chat or you can just wait for the session to get over. In the end, we will take up whatever questions come to you. Over to you, ma'am. You're on mute.
Yeah, thank you. Thank you for inviting me here. A very happy International Women's Day on the occasion of Women's Day. Actually, it was on 8th of March, but whole month we celebrate. In fact, whole month, what whole year we should celebrate because women are everywhere nowadays. As a gynecologist, today I'm here to discuss some of the points related to women's health, how to take care of your health, and what all things you should see. I mean, when to consult the gynecologist, when to consult the doctor, and all. I'll start from the reproductive age group female. So, journey starts from menarche to menopause. So, menarche is basically the period when the girl attains the period, so it usually starts between 10 years to 15 years of age and reaches menopause around 45 to 50 years of age. So reproductive age, approximately it is like 35 to 40 years. And see, you can see the magnitude of time the woman spend menstruating. So 420 periods, almost like approximately 420 periods in a lifetime. This is the picture which shows the normal like menstrual cycle you must have read in your 10th and 11th. So I'll just explain in brief so that I can discuss the points related to it. So first to 5 days is the your period. This green one is the period. So lining of the uterus sheds, the inner lining of the uterus shed during this time. And after fifth day, it varies. So this it might be for 3 days, it might be for 5 days, might be for 7 days, depends upon patient to patient. But average women they bleed for around 5 days, and after that, this follicular phase starts. So if you have a 28 days cycle, so this is the these are the days. Okay, so from 6 to 12, new egg matures, so follicular growth happens, and the lining of the uterus also begins to thicken. And around 14th day, ovulation happens, so egg is released, most fertile days. And after that, secretory phase starts. So if there is no fertilization, no conception, so egg travel to the uterus and then it dissolves. And the lining of the uterus continues to thicken and again the same thing starts. So period starts. So this is the normal menstrual cycle. So we'll discuss about the menstrual issues, what all menstrual problems, like most common menstrual problems we'll discuss now. So normal cycle is usually between 21 to 35 days. What is oligomenorrhea? If the length of the cycle is more than 35 days. Polymenorrhea, if the length of the cycle is less than 21 days. So if you have like 21 to 35 days of cycle, it's okay. Okay, so don't get worried. Amenorrhea, if there is no menstrual bleeding. Menorrhagia means heavy menstrual bleeding. Dysmenorrhea, painful periods. So some dysmenorrhea is also primary and secondary. So when to consult the doctor? So when you have little bit of cramps, little bit of like mild abdominal pain, little bit of leg pain and all, it's okay. But if you have too much of pain, like period pain, that you're not able to tolerate, you have to take medicines and all, then you need to consult the doctor. So to rule out the cause of the dysmenorrhea. So whether there is underlying pathology that has to be treated, you should consult the doctor. Now coming to hormonal imbalance. See, during reproductive, like in reproductive age, every day some hormonal changes happen. So if there is some imbalance, I mean, there is some imbalance and there is some cutoff because of any reason like stress, environment, lack of sleep, weight gain and all, there will be hormonal imbalance and you'll have irregular periods and all. So this is polycystic ovary syndrome. So many of you must be aware what is PCOS. So this is nothing just the hormonal imbalance. And this is the most common hormonal imbalance nowadays. So I'll discuss it in little detail. So it's a hormonal disorder among women of reproductive age. 10% of women of childbearing age nowadays estimated to have PCOS. So what happens in PCOS because of hormonal irregularity, hormonal imbalance, there is no ovulation. If you have a 28-day cycle, if your hormones are at place, then you will ovulate. If there is hormonal imbalance, ovulation doesn't happen. That's why irregular periods are most common. So, what are the causes of PCOD? Causes, most of the time, it's not clear. Sometimes it's related to genetic. Lifestyle is the most common reason of PCOD and stress. And what are symptoms we see? Acne, hirsutism means growth of facial hairs, weight gain, irregular periods, and fertility issues. So, what is the treatment? Treatment is, see, if you're overweight, you can reduce your weight by diet and exercise. And there is no treatment for PCOD as such. We treat symptoms of PCOD. So many times, people, like females, they come with irregular periods. So we give medicines for irregular periods. But the permanent solution is lifestyle modification. If you are overweight, you have to reduce the weight, you have to eat healthy, you have to do regular like physical exercises. Nowadays, we are seeing patients, they are thin. They are not overweight. Still, their periods are irregular. Still, they have PCOD. So the treatment is little different for them. And many people, they have this infertility issues because ovulation doesn't happen. If it doesn't happen, then definitely you'll have the infertility issues. So we treat those things. So there will be some cosmetic issues, so cosmetic treatment will do. So this is clinical hyperandrogenism. This is also very much related to PCOD. So this is the first picture shows hirsutism, excessive growth of facial hair, then alopecia, like androgenic alopecia, hair loss, then acne, and these black marks on the back of the neck. So this is called acanthosis nigricans because of the insulin resistance. Now, see, I have this hormonal irregularity maximum time, it's a PCOD, so I have discussed in reproductive age group. Now, coming to the breast cancer, little bit I'll discuss about the cancer because breast cancer is one of the most common cancers in females in the India, not one, it is the most common basically, and it accounts for 25 to 31% of cancers of urban India. It occurs usually in younger age groups between 30 to 50 years of age. And if you are aware, then like half of the battle is won. So, what are the signs and symptoms? When to consult the doctor? So something is called self-breast examination. That slide I'll explain later on. So these are the symptoms. So lump in the breast, this is the most common symptom. So painless lump. So if you feel you are palpating your breast and if you feel there is some lump, then you need to consult immediately. If there is pain in the armpits or breast, that doesn't seem to be related to your periods. So before periods, many female they have like tender breast becomes painful. But if there is some pain which is not related to the periods, then also you need to consult the doctor. If there is any pitting or redness of the skin, like the skin of an orange. So these are the symptoms. So painless lump, skin dimpling, change in the skin color or texture, change in how the nipple looks. So there is change in the nipple, Then if there is any discharge, like clear or bloody discharge from the nipple. So these are the some of the symptoms of breast cancer. You should consult the doctor immediately. So when you should get the clinical breast examination, then women in their 20s and 30s should have clinical breast examination every 5 years with the doctor. And after the 40, you should consult every year for the breast examination. And this is the self breast examination. So this you should start in your 20s, and any changes, whatever I told you, like whatever the symptoms, if you detect any changes, then you should consult a doctor. And these are the positions: so standing position, lying down position, circular motion. With this part of your finger, you have to palpate the breast. Now coming to the cervical cancer. Before cervical cancer, like 10 years back, cervical cancer was the most common cancer. Nowadays, because of the vaccine and screening methods, it has become the second most common cancer in India. But still, global burden is 80% cases in developing countries. It is very easily accessible for visualization. It has a long natural history. HPV, human papilloma virus, it is one of the most common cause. So we give vaccine for this. And these are the low, there are different variants of HPV, and we have vaccines against different variants. So this is the normal, the cervix is the mouth of the uterus, this is the vagina. And in case of cervical cancer, we see some changes in the cervix. So when to consult the doctor? Uh, like if you have continuous vaginal discharge, in spite of the treatment, discharge is happening, like it's very recurrent, then better we should do further testing. If there is foul smelling or thick discharge, if there is repeated vaginitis or urinary tract infection, in case of postcoital bleeding, if there is cervical erosion, this you can't know. Cervical erosion, like we only examine and we'll say, okay, fine, cervix is looking healthy or some erosion is there. So we give treatment for that. If again it occurs after the treatment also, then better to go with the further testing. Irregular or intermenstrual bleeding, like bleeding between the periods, especially in the premenopausal phase, then these are some of the symptoms of like precancerous or cancerous cervix. Now, screening for the cervical cancer, pap smear, most of you must be aware of pap smear. There are different types of pap smear nowadays, classical pap test and liquid-based cytology. So what is this? This is the smear of the cervix to be visualized under the microscope to rule out the cervical cancer. And recommended age is 25 to 49 years. Every 3 years, you should get it tested, and every 5 years if you are between 50 to 64 years. So till 65 years of age, we should do the pap smear. And if there is any suspicion in the smears, then we go with the further testing, that is the colposcopy. So this is little blurred. So this is the basically how we do the pap smear. So this is the speculum we insert, and we insert one cyto brush. We take the smear from the cervix. So it's a very simple test, but you should, if you have not done, you should get it done. So there are vaccines available. Gardasil is the most common brand which is available worldwide for the cervical cancer. So it is available in two varieties, Gardasil 4 and Gardasil 9. So Gardasil 4, it is active against 4 variants of HPV. Gardasil 9 is active against 9 variants of HPV, and but the dose is same, 0, 2, and 6 months. Almost nil side effect, but nothing is 100% safe. Some people might develop side effect, but usually it's very less. And recommended age group is between 9 to 45 years of age. You should take this vaccine. Now, coming to obesity, so better you should get the BMI done, and to screen the obesity, there are different categories of obesity. So India has the third highest number of obese and overweight people in the world. 11% adolescent and 20% of the adults are obese. In fact, School going children are also they are also overweight. So these are the categories you must be aware, like underweight, normal, overweight, obese. So if you're obese, you should, or overweight, you should reduce your weight, because there are lots of diseases which is related to the obesity. Cholesterol, so get your lipid profile checked. After the age of 40, you should get it checked yearly. But if you have anything, nowadays people, they are saying like after 35 only, you should get your health checkup done. So you can go in for the preventive health checkup done, and then this will cholesterol, triglycerides and all, because if you have high cholesterol, you can develop diabetes, high blood pressure, heart diseases. And if you're smoking and all, this is directly related to your uh, like abnormal cholesterol. So stop smoking also. Blood pressure. So have your blood pressure checked at least every 2 years. If your blood pressure is more than 140/90, then better to consult cardiologist and get further tests like ECG, echo and done, and start with the medicine. Diabetes, I told you, like after 35 years of age, you should do a preventive health checkup that includes all your blood tests like sugars, thyroid, vitamins, lipid profile. And if there is anything, then you should consult the doctor and start with the treatment. What is perimenopausal age? So this is the transition period which leads to menopause. So it varies. So for some female, it is just for 1 year. For some female, it might be for 5 to 6 years also. So when menarche starts, like when period starts, that time also hormonal imbalance happen towards the menopause. In the like menopausal transition phase, lots of hormonal imbalance happens. So there are lots of issues because of the hormonal imbalance. So hormone levels becomes irregular, and it begins in your 40s but can start earlier or later and last for average of 3 to 4 years. Menopause, it is considered to have occurred after a woman has gone a full 1 year without a period. So these are some of the menopausal symptoms, uh, like hot flashes, memory issues, sleep issues, weight gain, extreme skin dryness, extreme tiredness, bone loss. So these are symptoms for the menopause. Osteoporosis. So after the age of 65, bone density test should be done to screen for the osteoporosis. Now, this is not for you, but from now onwards, you to maintain the calcium level in the blood and the bone, you should take 3 cups of milk products. If you're lactose intolerant, then you just consult the physician and then you ask proper diet what to take for the improving the calcium, like whether calcium or vitamin D supplements are required or not, because bone health is very important. You should start doing some weight bearing exercises, which helps in just taking the supplements, taking the calcium. It will not improve your calcium or bone mass density. You have to do some exercises that should be like weight bearing exercises. And alternatives to dairy products include like fortified foods and supplements. I told you sunlight exposure, which is nowadays you can go for the sunlight exposure. So that is very much important for vitamin D activation. And depending upon your age, you should get the recommended screening test done and take the preventive medicines if you need it. So ultrasounds, blood pressure, then blood glucose, pap smear, breast cancer, mammography. So these are some of the tests which are to rule out some diseases. You should get it checked. Healthy habits. So emphasize on fruits, vegetables, whole grains, fat-free or low-fat milk and milk products. Include lean meats if you're non-vegetarian, then poultry, fish, beans, eggs, and nuts. And eat food low in saturated fats. So avoid outside food basically. Occasionally, like in parties or once in a week, it's okay, but avoid too much of fried items, bakery products, chips, biscuits, cakes, and all, and added sugars completely you avoid. Once in a week is okay, but not on a regular basis. And drink plenty of fluids. So be physically active, walk, whatever form of exercises you should start on a daily basis. Give time to yourself, minimum 30 to 40 minutes of physical activity is important to maintain the hormones. And avoid binge drinking because it can lead to liver damage, increase in BP, fatigue, and memory loss. Pregnant women, anyway, they don't have to take alcohol, and no smoking. So, no smoking and lack of sleep. So many people, they think, no, I mean, I'm fit, I do everything, still I don't have energy. So sleep is also very important, because if lack of sleep does have an impact on the health in terms of decreased concentration, fatigue, and heart problems. So for a healthy lifestyle, always make sure that 7 to 8 hours of sleep is very much essential. Be more adaptable, so avoid stress wherever, like at your workplace or family. Just try to avoid stress. Worrying too much leads to fatigue, anxiety, and depression. So how to avoid stress? Do regular exercises, some yoga or meditation. So mental health, many people, they don't discuss about this, but mental health is also very important. So change your, whatever I told you in my previous slides, same thing you just do, like lifestyle, stress, optimism, family history, exercise, outdoor activities, denial, counseling, and medication is the last option. So the best way to stay healthy is practice a healthy lifestyle, proper screening test, and act appropriately. Stay healthy, and thank you.
Thank you so much, Dr. Archana. Everyone, in case you have any questions, you can unmute yourself and you can ask, or you can put your questions in the chat. Doctor, there's a question. Are there any
Yeah.
evidence-based lifestyle changes that significantly reduce hot flushes and mood fluctuations?
Yeah. So, see, hot flashes and mood fluctuation, I mean, it is depending upon the age. So, what is the reason for the hot flashes? If you are towards the menopausal, like, I mean, towards the menopause, then definitely lifestyle changes. If you lose weight, if you start doing physical activity, if you have proper diet and all, definitely it reduces hot flashes, and it will improve your mood also. But in spite of doing everything you have done, you are doing everything, still there are there is no relief, then better to consult doctor. There are some medications also to reduce the hot flashes and mood fluctuations. Second question is, for women in their menopause phase experiencing early onset of arthritis and osteoporosis, as a vegetarian, what can they possibly do to cure or get rid of it? See, if first to consult the orthopedician, okay, so and get the X-ray done. If it's required, bone mass density and all, it should be done depending upon the I mean, whatever is the reason, they will ask you to take the supplements like calcium or vitamin D and all, but better to consult orthopedician for this if you have some arthritis and osteoporosis issue. So next question is, I was diagnosed with UTI and have it for last 7 years. After consulting a gyno, she says that there is a small fibroid. I believe that is okay now after taking medicine, but now also sometimes I feel itching inside and uneasy. What can be reason for that? See, UTI and fibroids, usually these are not related. Okay. So, I mean, if you have recurrent UTI, so drink lots of water, get one ultrasound done for the kidney, ureter, and bladder to rule out the stones, basically. If now you're saying that you are okay now, but itching is there. So, itching like vaginal itching or perineal itching. So itching inside, I feel it's vagina only. So that is not related to fibroid or UTI. The reason is different. Females, they are very prone for the vaginal and urinary infection because of the anatomy. So take medicines properly, maintain hygiene, if check for sugars, improve the immunity. So I think that will help. Uh, I'm 39. I'm doing exercise, eating healthy, but weight is not reducing. I have thyroid and BP also. How to overcome hormone imbalance? See, that's what. If see thyroid, if you have thyroid, you have to take the medicine on a regular basis and keep your TSH level, like check your TSH every 3 to 4 months. And so if you are not reducing weight on your own, then you have to take, I mean, a professional opinion. So you need to consult some dietitian, you need to consult physiotherapist. Dietitian shall give you a proper diet chart, how to reduce your weight, what all things you have to take. So sometimes you do like from your own, you eat healthy and all, but that is not enough. As age advances, some people they are not able to reduce the weight. So better to consult some professional and get yourself checked. Vaginal itching. Yeah, so vaginal itching is, I told you, maintain your personal hygiene. Okay, and get, if it's very recurrent, then we take the vaginal swab. And what is the most common cause is fungus. So we give antifungal. If it is not helping you, then we have to test in the lab that what bacteria or what organism is causing itching. Okay, is it true that all women need to lift weights to be healthy? Will only yoga not help? See, yoga, what kind of yoga? Because stretching exercises, lifting weight, it's not very important, but yes, you have to do some stretching exercises, some strenuous exercises. If you are able to do, then better you should learn from yoga instructor. And then, because see, bone for having bone health, no simple yoga will not help. You have to do either very much stretching exercises or weight, little bit of weight lifting, you should do. My menstrual cycle is regular, but the flow lasts only about 2 days. Could you please advise what is considered a normal duration of period flow? See, depends upon your age. So, and how was your periods before? I don't know. I mean, see, ideally it should be for 5 days. But if your flow is normal for 2 days and you have get your ultrasound done, there is no issue. You have done all your hormonal test done. If everything is normal, then I think it's okay only. How effective and safe is hormone replacement therapy today, and for whom is it recommended? See, hormone replacement therapy we give for post-menopausal females only, and if like she is having too much of symptoms, I told you the menopausal symptoms like hot flashes, excessive dryness, excessive mood swings, and all. If we have tried like I mean some medicines are there which are not hormones, so initially we try with those medicines. If it is not helping the female, then definitely we have to start with the hormone replacement therapy, but that we can't give for longer duration. That is given for like 3 months or 6 months or maximum of 1 year. Because and then we tell them, okay, fine, I mean, you do some we give some other supplements also. So it is safe, but not for the longer period of time. Ma'am, at the age of 45, changes in monthly flow between days, 1 day flow, another day no flow, same continuous for 5 to 6 days. Is this normal? It's okay because you are 45 years of age, so little bit of irregularity will start. I told you, like menopausal transition or perimenopausal phase, it can vary between females to females. So if you have less flow is not a cause of concern after 40 because you don't have to conceive and all. So less flow is not a cause of concern. But if you have heavy flow, continuous flow, or if your period is coming like every 15 days, then you should consult the doctor. Can you also tell us about endometriosis and adenomyosis? See, endometriosis and adenomyosis actually, it's also very common nowadays. Yes, definitely. That is also comes under the hormonal imbalance only. So, endometriosis, the main symptom of endometriosis is pain. So, female, they will have more of like pain during the periods. So, and they will have difficulty in conceiving also. So, see, when period starts, what happens? The blood comes out to the vagina. In endometriosis, what happens? Little bit of blood goes backwards. So, there is retrograde flow. So, from the tubes in the peritoneal cavity. So, whenever the female has periods, so, pain is more because blood is going in the abdominal cavity also, and most common location is ovaries. So, endometriotic cyst in the ovaries also, it's very common. So, depending upon the symptom of endometriosis, there are different grades of endometriosis. So, we treat it. Okay. So, if it's like little bit of pain during periods, okay, fine. We'll just manage with the medicines. But if there is chronic pelvic pain, like without periods, also some female they are experiencing pain while having intercourse, also they'll have pain while like too much of pressure symptoms. So that is stage 4. That is very severe grade of endometriosis. So in those cases, we have some medicines we can give for 1 year or 2 years. Nowadays, we have little better form of medicines also. We can try for 2 years. After 2 years we have stopped medicine, suppose, and still the patient is having pain and all, then we go with the laparoscopy because adhesions are very common in endometriosis. That is the reason for the pain. So pain is the most common symptom. Some female they have heavy bleeding also, so we treat like symptomatically we treat. So what is the symptom, with what symptom patient has come? And adenomyosis also the same thing. So, like there is thickening of the muscle layer of this uterus, that is called adenomyosis. So, in that also, some female has pain, some female has heavy menstrual bleeding. So, depending upon the symptom, we treat it. Okay. And next question is it true that C-section leads to excessive backache and bone health goes drastically down? What can be done in that case? No, it is not true. So C-section, that is a myth that C-section leads to backache. See, we give spinal anesthesia when we do C-section. So people, they think that because of spinal anesthesia, I'm having backache. No, because of the bad posture. See, after delivery, uh, like female they have to feed for longer time, and every 2 3 hours you have to feed the baby. So people they like bend too much, and they are not maintaining their proper posture. They don't do normal physiotherapy exercises and all. That leads to backache. And bone health is also not related to C-section. You have to take your calcium supplements till you feed the baby. So ideally it should be taken for 1 year, but for 6 months to definitely you have to take your calcium tablets. So and start doing like after 2 months of your C-section, you have to start some exercises. You need to consult some physiotherapist and you have to start some exercises. So that will maintain the bone health. What are some subtle mental health challenges linked to hormonal changes that women often don't recognize? See, basically depression, that is the most common. Sometimes anxiety also. And at what age hormonal changes? See, some hormonal like changes happen before during the reproductive age group. Some hormonal changes happen like around the menopause. So in the reproductive age group, if you have hormonal issues and also maximum time patient, they comes with the depression. They don't like, I mean, they don't feel like doing anything. They feel more tired and all. So depression is the most. Second is like too much of anxiety. So like with little stress also they become so much of anxious, so much of anxiousness and all. So these two are basically most common things. So but there are some like psychotic and all that is usually not very common with the hormonal. So depression and that's what depression is the most, and anxiety. So these are the most common health issues. My BMI is exact 25, 5.1 feet, 60 kgs. Menstrual cycle is regular and correct. I'm healthy also. What should I do with my weight? Your weight is fine only, no? I mean, no issues with the weight. Just see, eat healthy, and do some kind of, if you are healthy, your weight is okay, BMI is okay, everything is fine. But if you don't do any exercises, if you start having I mean that's what, fried items and like junk foods and all, you will definitely gain weight in few years. Okay, so to maintain your weight, you have to do some like 30 to 40 minutes of exercises and have healthy diet. I have seen several reels on Instagram showing pregnant women doing extensive physical exercise, gym, Zumba, and dance. Can you please tell if all that is just a gimmick or is it true and safe? See, depends. Okay. So, you are like you are doing Zumba or dance or gym when you conceive. Before conceiving, only you are doing, right? So you can continue, but avoid lifting heavy weight and all. That's all. Okay. So if you see, pregnancy is not a disease. It's a normal physiological change. So if your body is used to of doing some exercises, you can continue during pregnancy. But nothing new we tell our patients to start. See, you were not doing any physical, like extensive physical exercise before pregnancy. During pregnancy, I will not tell my patients, okay, fine, you start doing this exercises and all. No, that is not recommended. Like if you are not, if you are doing like swimming or Zumba or whatever, if you're doing, you can continue like gymnastic, everything you can continue during, but if your body is used to, if you're not used to, don't start anything new. So first 3 months, go little slow, just walking. Okay. If you were not doing anything, if you are doing, you can continue. Definitely you can continue. But if you want to do some exercises during pregnancy, if everything is going good, there is no high risk during pregnancy. After fifth month, we tell our patient to consult some pre like yoga expert or physiotherapist. They will teach you some exercises which is safe during pregnancy. They will examine your body and they will tell you like how much flexibility is there, which exercises is suitable for you. So you should consult some professional and they will tell you exercises what is suitable for you. Right age to take HPV vaccine. What are the possible side effects? So HPV vaccine we start giving from 9 years of age till 45 years of age. And there are two variants available. I told you Gardasil 4 and Gardasil 9. But the female, if you take the vaccine before starting sexual activity, so for young girls, it's more protective, but it can be taken till 45 years. That is the guideline. Side effect as such, it's safe. We have not seen much side effects. Most common is the pain at the injection site. That is the most common side effect. Ma'am, is it okay to shave our private part or is there any side effect? Shaving and all you can do, but maintain the hygiene. Some people, they have this itching or too much of dryness after the shaving. So it's if you don't have any issues after shaving, it's okay. Otherwise, don't use, try to avoid using creams. So hair removal creams you should not use in the private parts because it's a sensitive area. You can have reactions. So trimming is best or waxing. Okay. So if shaving is suitable for you, you can, but better you just trim with the scissor or you can go with the waxing.
Everyone, if there are any further questions, you can please put them in the chat.
I have taken one injection of HPV and it is told that there are three injections that needs to be taken. I took after my first baby who is now 7 years. Do I need to take the injection again from the start? Yes. You have to start the whole dose, like 3 doses you have to take again because it is more than 1 year. So within 1 year, suppose, say it is given in 0 to 6 months, right? Suppose you have missed the second dose. So within 1 year, you can take the second dose, and then after 4 months, you can take the third dose also. But it is more than 1 year. So you have to repeat your schedule again. Which HPV do you recommend in this case? So any see in India we have two varieties. I told you Gardasil 4 and Gardasil 9. So till 26 years of age, we give Gardasil, like we can give both. Gardasil 4 also, Gardasil 9 also. After 26 years of age, usually, like according to Indian guidelines, we have to give Gardasil 4. But universally, we can give Gardasil 9 also. Okay, so any vaccine you can take. It is okay. I have periods only for 2 days. My age is 36. So, see, just get if you feel that your flow has come down, before it used to be like for 5 days, now it has come to 2 days, then you just consult the doctor, get the ultrasound done, get some blood test done to rule out the deficiency. If everything is normal and then it's okay. Then there is no issues. You just continue having healthy diet and exercise. If all your reports are fine, no worries. How can we identify early signs of hormonal imbalance? So, if you are in reproductive age group, then hormonal imbalance, first sign is you will have irregular periods. So, your periods first, it will become less, and then you will not get your periods every month. So, it will be delayed like for 10 days, 15 days, and then you will have no periods. So, irregular period is the first sign. Second is weight gain. So, in spite of doing everything, you will gain weight. So, that is also one of the sign of hormonal imbalance. Can you please suggest some supplements for women in menopause? See, I can't, there are lots of supplements. So, better, I can't give you prescription here for the supplements. You should consult the doctor. What can be the reason of spotting? What spotting? I don't understand. Where, when spotting? No, blood spotting, it's okay, but when, like during pregnancy? Between cycle. Okay. So, if your periods are like, suppose it's a 28, 30 days cycle and you are bleeding in between your periods. So depends for how many days you are bleeding. So if it's very less, like between your cycle around 14, suppose you have 28 days cycle and you are spotting around 14, 15 days. So that is at the time of ovulation you are spotting. If it's less, if it's not that much painful and all, it's okay, because sometimes ovulatory bleeding also happens. So, if it's bothering you, then better you should get yourself checked once, get the ultrasound done to rule out the other cause. That's all. Tejan, battery. My 16-year-old daughter has irregular periods. Do I need to consult a doctor or will it regularize on its own? Uh, so irregular periods, like how much is the irregularity and when it started? So see, after the menarche for 2 to 3 years, many girls they have irregular periods because lots of hormonal changes happen. So if bleeding is not too much, then you can wait. Okay. But if you feel no, it's like more than 3 years of menarche, still it is irregular period. I mean, your daughter has irregular period, better to consult and get checked. I'm 30. What is the right age to conceive? See, there is as such. I mean, there is no right age. Whenever you are mentally and physically ready, then you should start, okay, trying. So whenever you are ready, then you should start trying. But ideally, before 35, you should conceive. Because as age advances, the risk is more. Why does it?
Any more questions? Okay, I think then we can wrap it up, Dr. Archana.
Sure.
Yeah. So
Thank
thank
you.
you so much, Dr. Archana Singh, for such an insightful and informative session. We truly appreciate you taking out the time to share your information with us today. Thank you, everyone, for being available here, actively engaging throughout the session. We hope you found it helpful and meaningful. Wishing everyone a very good health. Have a wonderful day ahead.
Thank you.
Thank you, everyone. Bye bye.
Bye bye.
Bye bye.